The World Health Organization has just released its new list of the world's most depressed countries. The United States comes in at the third most overall depressed country after China and India. The U.S. comes in steadily at third for unipolar depressions, anxiety, drug and alcohol use. So how can this be in the most powerful and richest nation the world has ever seen? To help answer that, I'm being joined now by Dr. Lisa Palmer. She's a psychotherapist in the Miami area. Dr. Palmer, thanks for being here to shed some light on all of this. What gives? Is the quality of life here worse off than it appears? How can we be third behind China and India?
Well, we definitely do have a mental health crisis in America. You know, 15 million Americans are affected by depression. 60% of them are actually taking antidepressants. And believe it or not, suicide is a 10th leading cause of death in America. So it is a very serious issue. I agree with that.
Now, according to the WHO, India and China and the U.S. are also the countries most affected, like you said, by anxiety, schizophrenia, bipolar disorder. Do you think these numbers are skewed, though? Because in places like Iran or Pakistan or Indonesia, I can't imagine that many people are reporting mental health issues or seeking the help of therapists. Are these numbers just skewed?
That's true. That is definitely true. You know, there is a mental health stigma. I think that more people in America are prone to report or get help, so the numbers may be skewed that way for sure. But, you know, also there is that pressure in America to achieve the American dream, and people definitely have a hard time with that work-life balance piece, skillful thinking, skillful living. A sense of loneliness and isolation is very much prevalent. Very much because of the independent nature of our culture as well, which is definitely affecting people in their depression.
And now we also have a huge military, obviously, here in the U.S., the largest in the world, along with 15 years of war in the Middle East. Do you think those elements factor into our depression ranking because there are so many people back from fighting wars and they're many of them are depressed, and there's 22 vets per day that kill themselves.
Absolutely. You raised such a great point because PTSD is prevalent. And by the way, post-traumatic stress symptoms have very much of a stigma, and that needs to be changed because post-traumatic stress symptoms are actually normal symptoms that result when you're in a painful experience or you're in that fight or flight response. So part of a good therapeutic regimen is to really reverse that normal response that happened to help people to better function on a daily basis without having to turn so much to medications as a way to cope, because these medications, which are often put and prescribed to people, they provide temporary relief but not long-term solutions.
Now, you mentioned earlier how the U.S., the American lifestyle, the push to be better, to make more money, to work more hours. How does this play out in the long run if people don't change that kind of lifestyle as an American societal norm? How do we shift that?
It's a really hard thing to do. When you think about it, we're really overworked. Americans work an average of 8 to 9 hours a day. The Swedes, for instance, they're working about 6 hours a day, so they're making time for rest. So it's really something that we have to work on as Americans, that when we do have that time, how to best utilize that time for ourselves, to take care of ourselves and to take care of our health and really prioritize and focus and work on our positive belief systems and things like that, and not just turn to quick fixes and medications to help us sleep and to help us cope. That really giving people education that there are better and more effective ways of doing this and relieving emotional symptoms that are toxic for us and keeping us stuck. So I think education is the key, and I'm really hoping that our future president can focus on that and put funding toward mental health care, because it's so much needed in our country.
Absolutely. We also definitely need a lifestyle change, like you said. And finally, what is your advice then to make America happier? How does each person just start being a little happier?
Well, obviously, happiness comes from within, and we have to focus on evaluating ourselves, and sometimes that means slowing down to take a really good, hard look at ourselves and our lives to see what needs to be changed first. And once we do that, then we can take the next steps, which may be finding the right help that we need to really relieve symptoms that are, for long-term benefit, not just taking a medication that's going to provide us temporary relief, and trying to look at some more holistic ways of doing this, which are very beneficial. And I do see a lot of my patients' symptoms being reduced even without medication, but because of proper therapy. So I think we have to do that and take time to enjoy ourselves in a healthy way, not turn to alcohol or drugs or negative recreational activities, but actually try to focus on the positive things that are going to bring us health and happiness.
Dr. Lisa Palmer, psychotherapist in the Miami area, thank you so much for sharing your expertise with us.
Thanks for having me.